हेलो।
पूरा पूरा और कम कर दीजिए। हेलो 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 हेलो। इज इट ओके? और थोड़ा कम कर। हेलो। यस। ही इज गॉन टू कॉलिंग। जितेंद्र। Hello everyone, good afternoon. Welcome all to this World Hepatitis Day event. Thanks for joining on a short notice. With me we have 120 people in the field who is watching this program live. Just to highlight what is hepatitis, what is its repercussions and how dreaded disease it is. If you look at, that's a huge prevalence which is there, but what is challenge in this particular disease is very low diagnosis, and the treatment coverage is less than 1%. And if you look at the diagnosis is less than 3%, treatment coverage is less than 1%. So it becomes really challenging for the physician, because most of the time the patient ends up for surgery and then they go for a test, but otherwise it is remains asymptomatic most of the time. Yesterday, we got an article published in Times of India. As per WHO, the prevalence has increased in Maharashtra state. Case in point, from 9,000 to 65,000 in 4 years' time, it has multiplied. So this is really a dangerous one. Cipla, we are market lead in all these three molecules, whether TDF, TAF, or entecavir. We have close to 50% market share in this hepatitis B market. Keeping the ethos of our corporate caring for Cipla in mind, we have seriously started doing a lot of screening camps from last 3 months. More so as we are celebrating World Hepatitis Month this month. In July alone, we have 18,000 patient has been screened so far. To help us support our healthcare practitioners, in excess of 3,200 taken a pledge in supporting this early diagnosis of this dreaded disease. This we started on 7th July, and 26th July was the cutoff date, and we could manage 3,200 patients, doctors to pledge for early diagnosis. So there are various activities, screening camps we have done right from airports to police stations and all these places, and doctor's chamber, of course. We got a very rousing welcome from all the fraternity, doctors fraternity. But this is just a beginning. We are just getting, the whole game just get started. And I'm sure next 7-8 months we will reach the peak in terms of early screening and diagnosis. So with this, may I invite our Asia Book record team, Ms. Seema and Ms. Rajni, to the dais, please. May I invite Gaurav sir on the dais, please. Request Apurva to felicitate sir, and Ashok sir, followed by Dr. Gokte sir, please. Priyanka, if you could come up the stage, please. Followed by Jitendra and our marketing head, and Vaibhav is the man behind this campaign. See, he is, with a lot of rigor, a lot of passion, he has done this, and it was his brainchild. So may I request, ma'am, Seema, your.
Good afternoon, everybody. I'm Seema Manikot, and I'm pleased to introduce myself as the official representative from India Book of Records and Asia Book of Records to announce the record called Maximum Doctors Pledged to Defeat Hepatitis. India Book of Records is committed to record making since more than 20 years, nearly 20 years, as on today's date. It is registered under the Government of India and is affiliated to Asia Book of Records and follows Asian protocols as per the consensus arrived at the meeting of Chief Editors of National Book of Records in Ho Chi Minh City, Vietnam. Asia Book of Records is a platform where the record holders of all major National Book of Records, including India Book of Records, Vietnam, Indochina, Laos, Nepal, meet to compete and claim the title of Asia Book of Records. Today, Asia Book of Records holds a strong database of more than 40,000 entries. Now it's time to announce the record for India and Asia Book of Records for maximum doctors pledged to defeat hepatitis. Cipla Pharmaceuticals India set a record for the maximum number of doctors pledging to defeat hepatitis, a total of 3,194 doctors participated in this campaign. 3,194 doctors participated in this campaign. The initiative aimed to raise awareness, promote preventive measures, and felicitate early diagnosis for the disease as confirmed today, that is July 28, 2025. We extend our heartfelt congratulations to Cipla Pharmaceuticals India for achieving this milestone by setting a record with India and Asia Book of Records. The achievement shows their strong efforts for spreading awareness about hepatitis. We also thank all the healthcare professionals who took the digital pledge and supported this important health campaign. Healthy Me promotes a healthy we. So hoping to see a healthy India very soon with all the efforts that all of us are taking. Thank you all so much for doing this work. Now it's time to give the awards, give the medal and the certificates. So yeah, if
Vaibhav, you can come. It's the Vaibhav, the brand manager, who is putting a lot of effort, so you can come. Vaibhav, brand manager. Pranav sir, you can come.
we should have asked for more medals for medaling everybody.
Sir, before that, we would like to hear Dr. Gupta's thought on this, on hepatitis B. Just your thoughts, sir.
On hepatitis B. So any specific things or sure. So maybe a few reflections for everyone on hepatitis B. I know um, it's an offshoot in terms of treatment, at least from HIV. And I remember the first drug that we introduced for Hep B was lamivudine 100 milligrams, which was quite a shocker for everybody because it was the first oral treatment for Hep B. Of course, we knew that in 6 months, 50% people develop resistance due to a specific mutation, and we had to see what to do next. So 2 years later, we introduced adefovir, which was the first drug with a slightly different mechanism of action. That was, I remember, that was actually a real big launch. Adefovir, we did lots of work on this, lots of education programs, and then adefovir naturally went into tenofovir, right? Because tenofovir was just more effective than adefovir, and that's how TDF came into play. Then came entacavir, and then came TAF. So I don't think there's anybody else who's done 5 products all orally used for hepatitis B in the space of more than 20 years. So I think all of us at Cipla should be proud of this fact that we've introduced 5 drugs for hepatitis B, which I think no one else can lay a claim of. But as we all know, introducing the drug is not enough, right? If patients are not diagnosed, they will not benefit for treatment. And I think that's the importance of these camps. If you don't screen, you will never pick up, and therefore you will never treat. Earlier we used to believe that most of these patients were quote unquote healthy carriers, but we know for the last now many years that while they may have no clinical symptoms, many of them will have ongoing viral replication and develop symptoms and disease much later in life than now. And therefore it's important to pick them up early, know whether the virus is replicating, and then aggressively treat them. And this is a personal experience. I know one of my close relatives died recently of hepatocellular carcinoma. He had been Hep B positive for the last 20-25 years. So obviously it's been an outcome of him being Hep B positive that he developed hepatocellular carcinoma at the age of around, I think he is in his mid-60s. And unfortunately we know treatment of hepatocellular carcinoma is really nothing great. So this is actually what Hep B can lead to. It's not just hepatitis. The complications of cancer, the complications of cirrhosis, the complication of end-stage liver disease is really something that we all should be concerned about. So I'm glad that we are actually doing this, and really kudos to the whole team that if 3,200 doctors have pledged, you said 18,000 camps, right? 18,000 patient screening. We'll have also some great data coming up. What's the community prevalence of Hep B? We say 4%, we say 1%. There is a regional variance in the prevalence of Hep B. Maybe there are specific populations, like you said, we have looked at police, others, where we may find that rates may be higher or lower. I think that will give us a clue to where to screen further, maybe in a more targeted fashion than doing mass screening, but I think it will be great. So really congratulations, and congratulations to everybody who's here, who's actually made it happen, right? Thank you all very much, and thank you to the Asia team for really recognizing this effort by Cipla.
Thank you, Doctor.
pregnant women, and where the mortality rate, the risk of virus affecting the liver and causing mortality can be to the tune of 25%. If we focus on our water sanitation, hand washing, that can prevent majority of infection, and that holds true in hepatitis A and E also. Hepatitis C, through Cipla, we've been able to get so many people tested for hepatitis B and hepatitis C. We check their viral loads. Why we want to discuss hepatitis B and C? Because as part of trial for hepatitis B, C, and HIV, we don't want it to be transmitted through needle sticks injury, through blood transfusions, and specifically from mother to child. People who were born before 1990 or even before that, they, if they would have taken blood and where the blood was not tested, or people who are not aware of hepatitis C, sometimes the virus would have stayed in their liver for many years, and after 3 to 5 decades the virus can get active and can affect the liver and cause cirrhosis. Same way hepatitis B can also affect the liver. The best part of hepatitis B is that in 90% people it is short acting, short time. It comes, it will cause inflammation, our body will recognize, mount a response, and take away the virus. But hepatitis C becomes a chronic illness. Hepatitis B integrates in our DNA and stays with us for life. So if you get it, it's very difficult to eradicate. But hepatitis C, with beautiful medicines, just like a pop-up pill taken for 6 months, can completely eradicate the virus. That's why WHO, as part of their hepatitis eradication program, and through this World Hepatitis Day, we want to promote to eliminate hepatitis by 2030. And I will try to get a slide where we show these goals to you also. Through unprotected sex, through sharing needles, mother to child transmission, blood transfusions where blood is not properly checked and given, or through wounds which are open and a contaminated body fluid or blood is sprinkled or sprayed or splayed on them, the viruses can be transmitted. And that's where we want to ensure that people are aware that there are safety practices being followed at workplace, in hospitals, and as well as healthcare infrastructure. These are a few myths which all of us have to understand, that sharing food or sharing meals with people with hepatitis, or somebody who coughs, sneezes, or holding hands, or people if they have shared the same utensil or a glass for water drinking, will not spread hepatitis B and C. The taboo for hepatitis B, C, and HIV has to go away, and we need to take initiative for the same. What are the standard symptoms? This can hold true for any form of hepatitis, not B, but anything. People may have some fever, their eyes may become yellow, the urine color will be dark, they may have some nausea, vomiting. The most common symptom which I think we would want to remember is any sight or smell of food makes a person having an attempt to have vomiting or nausea should make us think that whether this person is having episode of hepatitis, swelling in the liver. If it happens within 3 months, we call it acute. If it is more than 6 months, we call it chronic. Headache, joint pain, fatigue, nausea, all can be part and parcel of hepatitis B or C. There are beautiful blood reports available which can diagnose hepatitis B and C within hours. And there are genetic testing available which give us the viral load of the blood to tell us who has got hepatitis B or C, and medications to try and control hepatitis B but cure hepatitis C. Use of standard sonography or sometimes using a small piece of tissue from the liver may be required. But there are tests known as fibroscan or the help of MR elastography. We can diagnose whether the liver has got features of chronic liver disease or not. If you can see, I have a short photo. Man, can everybody see this?
Recording in progress.
This is how swelling in the liver or a fibrotic liver will look at. And this is how cirrhosis liver will look like. Hepatitis B, C can make a person go from a normal liver to cirrhosis of liver if not checked in time, or if no action is taken when we have known that we've got infection. Because timely assessment and treatment can make a person remain in the same stage. And as I discussed in my previous slide, liver regenerates. So whatever is the damage in the liver can go back to its normal size shape. That is the principle which we use in our liver transplantation. that whoever be the donor, if he donates part of the liver, the donor's liver as well as patient's liver will go back to full size. Or at pregnancy, it is compulsory that we check for hepatitis B, C, and HIV. And that is the type maximum people in our country are getting diagnosed or vaccination is being provided. We want to change that now. We want to go to a pattern that all newborn babies receive the vaccine in time for hepatitis B and their other vaccines. Unfortunately, we do not have a vaccine for hepatitis C and HIV, but through patient support programs, through proper such support initiatives from various people, we can communicate and translate our message to the mass and community. Household contact, sexual contact of people with hepatitis B or C are at a high risk of hepatitis B. We need to have proper testing. We need to find out, we call it special groups, especially with chronic kidney disease, on chemotherapy, people who've got low immunity, they have high risk of getting hepatitis B and C. And sharing of needles, setting needles for some other uses, all have to be stopped. Can hepatitis be prevented? Absolutely. Vaccine is so effective that 99% people who have taken the vaccine have developed immunity. Less than 1% people who don't develop immunity, we double up the dose, we observe them, and they also will develop the immunity. The problem comes that after taking 3 doses of vaccine, we don't check our immunity. So there is a proper blood report available which will give us enough information that how we can prevent hepatitis B and C. Don't want to discuss hepatitis D right now for limited time frame. I'll go on to the next slide, next session. Just a minute. This is where I prepared the thing for our hepatitis B, hepatitis for fatty liver. Just a second. Are the slides shared now in this?
Yes, sir. Yes, they are visible.
Visible now? Just a second. So there's a lot of awareness about this word known as liver detox, and sometimes it amazes us because people believe that there are medications available which will help us to detox the liver. Unfortunately, there is none available to detox the liver. Because liver performs so many tasks, its key role is in detoxifying substances. A healthy liver itself is your detox. To take medications to detox the liver is actually a myth. And that is what I said, a healthy liver is a healthy body. If my liver is healthy, I am actually detoxifying everything. Excess alcohol, lot of high fat food, refined food, preserved food, leading to obesity and diabetes, long term medications or unnecessary supplements, exposure to toxins and harmful environment is the thing which affects the liver and makes us bad. We have discussed of A and E, but the most important thing to discuss is alcohol contribution to liver disease. And in our country right now, 6 out of 10 people have fatty liver. So fatty liver is the most common reason why people will develop these issues. And that is where we want to educate people. We want to hydrate well, eat food which has got high fiber, try to identify locally made food with antioxidants. Alcohol limitation is a good idea, but people who've got fatty liver, zero alcohol is the norm. Do not self medicate. People who've got extra weight around the abdomen, so what we call is a visceral fat, they have to burn that fat. Regular exercise to the tune of 250 minutes per minute per hour per 24 hours to over period of 1 week is the norm. So we target 30 minutes per day or practically 250 minutes over 7 days. If we can exercise regularly, it can help us to cut down fat. Want to focus on vaccination, want to focus specifically that there is no evidence of quick detox pills, juices. There is a need for us to trust science back methods. Do not try to fall prey for quacks which will say that take these medications and your liver will heal. Every year we do liver transplant for people who come with complementary alternative medications or people who take medications for detox using too much of protein supplements in an unprofessional way, using too much of growth hormones, taking medications to promote muscle building, all have known to cause liver injury and they do not work as a liver detox mechanism. And last part of the slide. This we want to talk more about NAFLD. When I say NAFLD, it's a condition where there is too much accumulation of fat in the liver. Global prevalence in India is increasing at a rate faster than any place on this earth. The change of nomenclature to call it metabolic liver disease is to create awareness among people that it is diabetes, blood pressure, cholesterol, heart disease, kidney disease, thyroid, polycystic kidney disease, uric acid, overweight, all are responsible to cause this metabolic dysfunction. That's why if we treat fatty liver, we can treat all. If we treat these diseases, you can treat fatty liver. Obesity, sedentary lifestyle, poor dietary habits, and diabetic population are one of the key risk factors for developing fatty liver. There's a study which was done recently. Around 2.5 lakh individuals were tested through blood reports and through sonography slash fibroscan. 65% people had fatty liver. So it's about time we take this into our own hands and try treating. Majority people who got tested had liver enzymes normal. So they thought, why we need to treat? But the fat in the liver over 5 to 10 years will lead to swelling in the liver. Over next 10 years, it will progress to fibrosis and cirrhosis. All our young, healthy population who are at desk work or who are currently working or who are watching us are all at high risk, including us, where we have to exercise and we have to try and see. And that is why we say it's a silent progression. There are blood reports available, there are various tests available through which we can all have an impact. We want to focus on green leafy vegetables, fruits, whole grains, legumes. We want to focus on better oils. We want to avoid things which give too much sweet. And that's where use of dark chocolates or sometimes dates with walnuts, Greek yogurts with berries can be your healthy snack. And that's how we can make a difference. Thank you.
Thank you, sir, for a very enlightening lecture. And apart from viral hepatitis, you also covered the normal diets and the supplements that people take, which can cause liver injury. So it was very exciting to learn about those as well. So there are a couple of questions which people have asked in the chat box and which have been posted to me. So I will go ahead and ask those questions to you. So the first question, sir, is that if a patient or a person who is not vaccinated priorly as a kid or as an adolescent, can he go ahead and take vaccination for hepatitis? And do are there any tests which are needed to be done before taking this vaccine?
Correct. So vaccines are some. I'll explain you what basically a vaccine is. Vaccine is basically a virus which is half killed. Correct. So when we take vaccine, what are we trying to do? We are asking our immunity to mount a response against the same. So we want to vaccinate people who first may have forgotten that they have taken vaccine or are very sure that they have not taken. If there is some dilemma that, oh, I think I may have taken the vaccine, oh, I think I've taken a booster, there is a standard test known as anti-HBs antibody titer. If my titer values are less than 10, I can either take a booster, or if I know that I've never vaccinated, I will take 3 doses. That is at 0 month, first month, and sixth month. And after taking 3 doses, I will again check this antibody. If my antibody has crossed more than 10, practically I develop lifelong immunity that I don't even need a booster. This is for hepatitis B, B for Bombay. For hepatitis A, we can check IgG HAV. So this is a blood test very easily available. Modern day people, because of eating on the street or sometimes this comes through food, through contaminated water, may have already developed antibody to hepatitis A. They may not need a vaccine. So that is why you check your IgG HAV. If you are positive, you don't need a vaccine. People who have not tested can easily test and decide that whether they need vaccination or not.
Okay, thank you, sir, for that elaborate answer. It really solved a lot of doubts that we had. So, one more question is, how frequently should a person get his rapid antigen test done
So,
as a part of screening, sir?
in rapid antigen, there are card tests available. They will give lot of false positive. Means people who don't have the virus, their report will come positive. Now,
Hmm.
suppose I have tested for hepatitis B and C. For
Hmm.
C, I have vaccine available. I will take the vaccine and I'm lifelong immunized. I don't need to check hepatitis B. For hepatitis C, if I'm a healthcare profession where I think I have got a needle stick injury or I have been infected with a contaminated blood, I can straight shot check. And if my hepatitis C viral load comes positive, I'll be treated for 3 to 6 months based on my report. So then I am treating to eliminate hepatitis C, to eradicate hepatitis C. C doesn't have any antibody or a protective antibody or a vaccination. So hepatitis B once has to be tested to know what is our baseline status. You will prevent B. You can prevent A because you will take vaccine for A. There are a lot of studies, and I'm very hopeful in few weeks to months to years we'll have effective hepatitis E vaccine. Whole world is waiting for hepatitis E, E for elephant vaccine. If we get that, it will also become part of prevention. For C, at this moment, we do not have treatment where you can, based on taking it from before, you get the virus, you treat yourself. So I would not advocate that you keep on doing it this yearly. Once, as a community or as a healthcare profession, our advice is to check and get a baseline. And then, if you're working in high risk profession, you want yourself to be tested yearly.
Hmm.
If you're working right now as a desk job,
Hmm.
you can take vaccines, prevent yourself, focus on alcohol and fatty liver because that is the bulk of the problem at executive level, where there is sedentary lifestyle, long working hours, difficulty in exercising, wrong food habits, sleep getting affected, working targets, so much at disposal. So for them, our message is to work on fatty liver and alcohol. That causes swelling and inflammation in the liver.
So another question is, if the patient had a previous episode of Hep C and they are already cured of it, can the patient get it again? Or do
Yes,
they have a lifelong immunity for it?
C never has lifelong immunity. Hepatitis B will have lifelong immunity. Assuming an individual is used to taking something through IV drugs, he shares the needle with multiple people, has got hepatitis C treated, and then again shares the needle. The same virus can come in the system. Normally, our blood transfusion practice have been excellent. Across the country, the blood what we transfuse to people is checked for hepatitis B, C, malaria, syphilis, HIV, five diseases. So it is impossible right now in a properly checked environment to get these viruses to blood transfusion. Sharing razors, having infected blood or infected contaminated blood fluid being disposed on a abrasive surface can then transmit hepatitis C. So if there is a doubt, if there is an exposure, you treat. This is what we call as post-exposure prophylaxis. So you try, if a healthcare worker at your place develops a needle stick injury, we would want them to be tested. We would identify from where the source is and effectively treat. So the virus, even if it has transmitted, before it develops hepatitis or any scarring on the liver, is completely treated. But to answer in one shot, hepatitis C can get again in the system. It can come back through a different source. The first source got treated, the new source came in the system, and then you want to treat it again.
So there's another question. If I have hepatitis, do I need to get treated lifelong for the same or require monitoring lifelong for the same?
Which hepatitis?
So hepatitis is mentioned.
Hepatitis means swelling of the liver. We discuss four topics. Hepatitis, that is viral hepatitis. We discuss about medicines causing hepatitis. We discuss about fatty liver causing hepatitis. Means overweight, diabetes, blood pressure, cholesterol. So that is a lifestyle thing which will keep on coming and going. You remain healthy, you keep your LFTs better, it will not come back again. I want to address the point basically in terms of alcohol. You will always come across this articles that WHO has said that there is some safety limit of alcohol. That safety limit is one drink per day in females and two drinks per day in males. So practically amounts to 7 drinks a week or 14 drinks per week for male. Now, what is that safety limit? Where has it come from? WHO assumed that everybody was normal. WHO assumed you do not have a fatty liver, your LFTs are normal. But how many people before drinking will check their LFT? Not possible, not logical, correct? So there is practically no safety limit. I'm exercising, I'm healthy, my LFT is okay. So occasional drinking is allowed. Now, what is drinking? So we call it in terms of quantification. 180 ml of beer is one drink. 45 ml of wine is one drink. 30 ml of hard spirits, which is rum, gin, vodka, anything in terms of hard is equal to one drink. But if people binge drink, have 4 drinks in 1 hour, that itself can be toxic effect on the liver. So it has to be assumed that we are starting on a normal nascent baseline good liver functions and a healthy liver. And that is where sometimes occasionally what we say is true.
Yes, sir. So as you mentioned about various liver function tests, so for a normal person, how frequently should he or she get his LFTs done just to monitor the health of the liver?
Right. So when we do this, this is part of epidemiology and part of preventive science, right? You cannot tell everybody that do LFT every year as part of health checkup. Many conscious people would want to do executive health checkups, the fancy term. That's not what you sitting in a hospital will tell everyone that you need to do it. I need to risk benefit. I need to have a cohort who is under stress. So somebody who is drinking alcohol, who's got family history of diabetes, blood pressure, metabolic problems, or he himself has a problem. Somebody who says, I have exposure to viral hepatitis. Such people have to be tested. Let's assume in your office right now, 100 people are hearing us. They are all executives having desk job, field work, normal health individuals. I need one baseline assessment. I need to assess what kind of risk factors they have got. And from there, we should take it further.
So similarly, for a patient who has a history of hepatitis, how frequent is monitoring with a fibroscan or an MRE essential for such kind of a patient?
Right. So we risk quantify in four. So actually, I wanted to actually make four such cases. Maybe next time we can. Let's
Sure,
say
sir.
there's a fatty liver. Case one is a simple gentleman. He, he has no problem in the liver. So he's
Sir,
assessment.
it is going on mute in between. Yeah, yeah. Now, okay. See,
It's on mute.
it's going on mute in between, sir. You're on mute.
Am I okay now? Unmute?
Yes, yes.
Yeah. So let's assume X case A. He just got fat in the liver. His LFTs are fine. His fibroscan is okay. He just needs to ensure healthy diet. He loses the fat from the liver. His fibroscan value we have done once. We know that he doesn't have chronic liver disease. We may not do his fibroscan again. We would have just checked his LFT. His LFT is okay. He has to give us 5% weight loss. If he's 100, he needs to be 95. From 95, can he be 90? We are very happy. Any person who loses 10% fat can reverse fibrosis. So from that nomenclature, if he loses 5% weight, his fatty liver would have settled better. But then you want his BMI 23 to 25. So for his health and his other comorbidities, losing weight is a no. Second individual who has fatty liver, but he's got swelling in the liver. His SGOT-PT has now started going up. So then we want to identify why the swelling is there in the liver. You find the cause, treat the cause, but follow the same protocol for fatty liver. Gentleman number C, he has progressed from fat, developed swelling in the liver, and now has stiffness of the liver. So if you can see me, this is soft liver, this is firm liver, this is hard liver. So this is fibrosis. Anybody can feel the liver through when they touch, when we examine the abdomen. So if we find the liver is hard, our hand is the fibroscan. Same way, you can use the fibroscan to know how much is the stiffness. For us as a hepatologist, this is the population we want to see to prevent cirrhosis and progression. There will be frequently doing fibroscan based on what it is, MR elastography or fibroscan to see that what interventions we are targeted, how much have they improved. Is the fibrosis reversing? Is the swelling in the liver coming down? And then we take it forward.
Yes.
A and B have to be treated at a community level by physicians.
Yes.
C is the patient who needs to come to us.
Mm.
D is a patient who has got cirrhosis, who has already come in complications. And that is where we'll be worried. We want to make them better, make them progress to cirrhosis complication. Think of liver transplant.
Thank you, sir. Sir, just to conclude today's session, can you give us like 5 important tips for liver health? Like just a gist of your session. I know you mentioned a lot of them during your lecture, but just for a recall value, can you repeat 5 most important tips for liver health?
Okay, so we'll start first. Do not come under the myth of liver detox. Under the pretext of liver detox, many medications, many home remedies, or many substances are available for us to consume. Please be away from them. Healthy living, good proteins, whey-based proteins are a good idea to build your thing. 1 gram per kg protein can be the norm. There is no need to take growth hormones, no need to be on strong supplements. We are not participating in wrestling. We are not participating in world. We want to be healthy. So that should be the norm. Fatty liver will hit us hard. 6 out of 10 people who come to our OPD have fatty liver. But if we don't know we have got fatty liver or we have not assumed what it is, then this will become an epidemic. We are already diabetes capital of the world. Wait for some time, we'll be fatty liver capital of the world. Alcohol, take it as a social drinking. Understand the risk. It's not that we are against alcohol. It's not that we have no to alcohol. But we need to know what is the safety limit, why we're drinking, what we're drinking. It cannot become an addiction. And at the same time, hepatitis B and C as a country, we can all work together to eliminate, to eradicate. That's the 2030 WHO goal. At the last point, today being World Hepatitis Day, the theme is control, prevention, treatment. When I say treatment, we don't want liver cancer and we want viral hepatitis to be eradicated.
Thank you, sir, for a very enlightening lecture and for taking us through all the slides. And apart from viral hepatitis, also taking us through various aspects of liver health, the importance of diet, the importance of drugs, which may be consumed inadvertently by the patients or persons. Also, telling us the importance of vaccinations and adult vaccination being a very important component of your talk today. So thank you, sir, for joining us. Actually, it was last minute, but still you took out time out of your busy schedule. So we're very grateful for that, sir. Thank you for joining us, and it was great collaborating with you for today's event, sir. Thanks a lot.
Thank you. I hope people have had basic gist out of it. Thank you.
Yes, sir, surely. It was really a very good lecture, sir. Thank you.
Thank you. मुझे BNC ठीक नहीं था एनो शू करो हेलो मैडम आइए 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 सर आइए आइए ये पीसी से कर सकते हैं मुझे लिंक इधर देखे हाँ मैंने सब इसमें ना बहुत जंबल स्लाइड्स है मतलब हमारा पूरा वीक बहुत खराब है इसी पे करूं आप जिससे कंफर्टेबल हाँ ठीक है वो हो जाएगा नहीं नहीं अभी मैंने टॉक दिया सब सब सुन रहे थे सर लैपटॉप पे चार्ज है हाँ हाँ फुल चार्ज है टीम्स चालू कीजिए मुझे आप लिंक दे दीजिए मैं इसमें टीम्स है शायद तो आ जाएगा आपने मेल किया है ना
सर मैंने मेरे नाम सर प्लीज जरा मुझे भारती दुबे
जैसे आप ज्वाइन करेंगे मैं ऐसे लिंक करूँ जो कल लिंक भेजा था वो अलग होगा ना आज आज वापस लिंक भेज
25 को भेजा है सर ये वेबिनार का
एक बार वापस भेजिए ये डॉक्टर नहीं बोल रहा उसी पे ना
ये आरएफएच वाले आईडी पे भेजो ना
नहीं नहीं जीमेल
वाले
चलो मुझे भेजो ना
ऊपर टीम सेल पे आपको आईडी बोल दो लिख के
इस आपने इस पे भेजा है क्या
ऑफिस
पे भेजा है उधर से मैं कन्वर्ट करता हूँ अच्छा आप वो लास्ट वीक में इस पे भेजा था आपने
यस सर
सर्च कीजिए सर बहुत नीचे गया होगा
ना ना इतना कोई नहीं माइंड से डलता
20 चलने का
20 जुलाई आ गया
भारती दुबे on behalf of Jessica Kodachi
25 तो आ गया नहीं
आप फॉरवर्ड करो ना
हाँ सर आपका ये बोला
ये डॉट हो रहा हाँ हाँ आ गया लिवर डिटॉक्स ओके
हाँ।
ये वाला
ये आपके जीमेल पर होगा।
तेरा भी चालू है।
हाँ जैसे आएंगे मैं छोड़
नहीं
दूंगा।
जैसे
सो ये अभी ये भी नॉर्मल लोग ही है ऐसे ना
this is for ideal students. This is for bankers.